Dear students, in this iLecture, I would like to give some prerequisite information which helps you to understand pharmacology of NSAIDs, which stands for non-steroidal anti-inflammatory drugs, and drugs used in rheumatoid arthritis. First of all, I want to introduce you all to a term called autocoids. Autocoids include monoamines such as histamine and serotonin, and fatty acid derivatives which include prostaglandins and leukotrienes. Their effects are usually restricted to the tissue in which they are formed, hence the term autocoids. But under pathological conditions, large amounts of autocoids can be released into the systemic circulation. Autocoids physiologically regulate certain aspects of gastrointestinal, uterine, and renal functions, and pathologically, they are involved in pain, fever, inflammation, allergic reactions, asthma, thromboembolic disorders, and other pathological conditions. Every cell in the body is made up of cell membranes, and all the cell membranes contain phospholipid bilayer. Inside this phospholipid bilayer is arachidonic acid, a fatty acid which is embedded within. Whenever there is cellular injury, be it chemical or physical, like cell damage, there will be activation of an enzyme called phospholipase A2. This phospholipase A2 releases the arachidonic acid embedded within the phospholipid bilayer to the surrounding tissues. Now this arachidonic acid is acted on by an enzyme called cyclooxygenase. This cyclooxygenase action causes the conversion of arachidonic acid to prostaglandins, which include prostaglandin E2, prostaglandin I2, prostaglandin F2 alpha, prostaglandin D2, and also thromboxane A2, which is produced in the platelets. These prostaglandins, formed in excess due to injury, play a prominent role in the genesis of pain, fever, and inflammation. They sensitize the nerve endings and increases the amplitude of their response to painful stimulus. There is a group of drugs called NSAIDs. These NSAIDs, or non-steroidal anti-inflammatory drugs, block the cyclooxygenase enzyme and thereby suppress the production of prostaglandins. And also, because of that, the pain, fever, and inflammation. There is another pathway that arachidonic acid can uh, go into, that is known as lipooxygenase pathway. Through this lipooxygenase pathway, the arachidonic acid is converted to leukotrienes. These leukotrienes are LTB4 or leukotriene B4, leukotriene C4, leukotriene D4, and LTE4. The main function of the leukotrienes is pro-inflammatory in nature. LTB4 mainly causes the chemotaxis of the neutrophils and other leukocytes, whereas LTC4, that is leukotriene C4 and leukotriene D4, are mainly involved in the uh, asthma condition, which causes the bronchoconstriction and causes the exacerbation of the acute asthma attack. A drug called xylitol inhibits the lipooxygenase and thereby inhibits the production of leukotrienes. And there are other group of drugs called as montelukast and zafirlukast. So these drugs actually block the leukotriene receptors and prevent the action of formed leukotrienes to act on the receptors. You can remember by the term lukast. Lukast means leukotriene antagonist against used in asthma. So whenever you come across a drug called zafirlukast, montelukast means leukotriene antagonist used in asthma. So imagine we have NSAIDs for the cyclooxygenase inhibition, which prevents the production of prostaglandins, and then we have xylitol and then zafirlukast, montelukast, which inhibits the production of lipooxygenase. What if we have a drug which inhibits the enzyme phospholipase A2? Won't it be wonderful? Do we have a drug? Yes, our famous and most popularly used and abused corticosteroids. Corticosteroids, that's why, are considered as the most potent anti-inflammatory drugs. because these inhibit the phospholipase A2 enzyme and thereby prevent the production of both prostaglandins and leukotriene. We saw that prostaglandins are responsible for production of pain, inflammation and fever and other inflammatory symptoms. But prostaglandins also have many beneficial physiological actions like gastroprotective action, renal homeostasis, and then induction of parturition during term labor. Okay, so that means it requires a small amounts of prostaglandins to be produced constitutively or continuously in the body for the beneficial physiological actions. This production of prostaglandins at the physiological amounts is caused by cyclooxygenase 1 enzyme, which is responsible for the physiological functions. And there is another enzyme, because this is constitutively produced, it's also known as constitutive cyclooxygenase. There is another type of cyclooxygenase which is called as cyclooxygenase 2 or inducible cyclooxygenase, which is produced in large quantities and is responsible for the production of large amounts of prostaglandins during cellular injury or related stimuli, which causes the pain, fever and inflammation. Let's look at some of the physiological functions of prostaglandins and some prostaglandin analogs that can be used therapeutically. Prostaglandin I2 and thromboxane A2 have got opposing actions. Prostaglandin I2, which is also called as prostacyclin, is produced by the intact vascular endothelial cells and is most prominent action is vasodilatation and inhibition of the platelet aggregation. But when there is damage to the vascular endothelial cells, the ability of the vascular endothelial cells to produce prostacyclin is lost, but there is continued production of thromboxane A2 by the platelets. So this thromboxane A2 causes platelet aggregation and then helps in plugging the damaged area and prevents excessive bleeding. And also there will be vasoconstriction caused by thromboxane A2 directly and also because of the loss of the vascular endothelial cells in producing vasodilatory prostacyclin. These are two important physiological actions which can be which can become pathological in excessive usage of NSAIDs or selective COX-2 inhibitors. Prostaglandin E2 has got a gastroprotective effect in the stomach. It decreases the acid secretion, increases the mucus production, and increases the bicarbonate secretion. Usage of NSAIDs can actually inhibit the prostaglandin production and hence the inhibition of the gastroprotective effect of the prostaglandins, thereby causing gastrointestinal diseases, most noticeably gastritis. This gastritis is usually managed, this NSAID induced gastritis is usually managed by a prostaglandin E2 analog called as misoprostol. In the kidneys, prostaglandin E2 and also prostaglandin I2, that is prostacyclin, causes vasodilatation and helps in modulating the renal blood flow and the glomerular filtration. And also it has antihypertensive effect by increasing the sodium and water excretion. So the NSAID usage can inhibit the prostaglandin production and thereby actually inhibit the antihypertensive effect of antihypertensive medications, and also long-term usage of NSAIDs can lead to papillary necrosis and interstitial nephritis, which are called as analgesic nephropathy. Prostaglandin E2 and again prostaglandin I2, they appear to have a role in maintaining pulmonary blood flow. Especially in utero, the prostaglandins help in maintaining the patency of ductus arteriosus, a vessel which connects the pulmonary circulation to the descending aorta in the fetus. At birth, usually this ductus arteriosus closes, but sometimes in some neonates with cardiovascular defects, it becomes necessary to maintain the patency of this ductus arteriosus. In these situations, a prostaglandin analog called as alprostadil, which is a PGE1 analog, is used to maintain the patency of ductus arteriosus. Prostaglandin E2 and prostaglandin F2 alpha causes cervical ripening and stimulates uterine contraction and assists in labor during term pregnancy. Prostaglandin analogs have been used therapeutically by utilizing this action. Gemiprost is an analog which is used mainly to cause cervical ripening and cervical softening. Dinoproston is another analog which is especially used to cause uterine contraction, just like oxytocin, for induction of labor. Carboprost is another analog which is mainly used to prevent postpartum hemorrhage. Prostaglandin F2 alpha also promotes uveoscleral outflow of aqueous humor and reduces outflow resistance. In other words, PGF2 alpha enhances the drainage of aqueous humor and reduces intraocular pressure. The analogs that have been used for this purpose are latanoprost, bimatoprost, and travoprost. These are used topically to reduce the intraocular pressure in conditions like glaucoma. Now it's time for the quiz. So let's see how much you have understood about the topics just now discussed, and then we will further go ahead. Before ending this lecture, I would like to tell you why prostaglandins were called as prostaglandins. Prostaglandins were first isolated in semen, so it was thought that it was produced by prostate gland, and hence the name prostaglandin. Thank you.